If you've ever dealt with serious back pain, you've probably heard about steroid shots. They're a super common treatment, a go-to for doctors, and honestly a ray of hope for millions of people. But what's actually going on when they inject that stuff into your spine? Well, today, we're going to break down the real story behind lumbar epidural steroid injections, or LSIs for short, and figure out if they're the miracle cure they're sometimes made out to be.
And that really is the big question, isn't it? Is this powerful treatment a permanent solution for chronic back pain, or is it more like a temporary patch? The answer, as you'll see, is a little more complicated than a simple yes or no, and it has huge implications for how we deal with one of the most common health problems in the world.
So to really get why these injections are so popular, we have to first understand the sheer scale of the problem they're trying to solve. Why are they so incredibly common?
The reality is, well, it's pretty staggering. We're not talking about some rare condition here. Chronic lower back pain is a global issue. It affects your job, your family life, your ability to just enjoy the day. It's a massive problem, which is why finding treatments that actually work is such a huge priority.
And that's exactly where these injections, these LSIs, enter the picture. For doctors and patients facing this huge challenge, these shots have become a key part of the playbook. You know, they're often that logical next step when physical therapy isn't quite enough, but you're not ready to talk about something as drastic as surgery.
Okay, so let's get into the nitty-gritty. What is actually happening inside your body when you get one of these shots? It's not just about numbing the pain, it's about going after the root cause on a chemical level.
Honestly, the best way to think about it is like this. Inflammation is basically a chemical fire that's burning around your nerve roots, causing all that pain. The steroid in that shot, it's like a super advanced fire extinguisher delivered with pinpoint accuracy to put those flames out right at the source. It's not masking the problem, it's actively fighting the fire.
And here's the science to back up that fire extinguisher idea. The research shows that the steroids directly attack and reduce the chemicals that cause all that swelling and irritation. The fancy name for them is pro-inflammatory cytokines, but all you need to know is that they're the troublemakers. The steroids basically shut down their whole operation.
So if we break it down, it's a pretty straightforward process. First, the shot delivers the steroid right into the epidural space. That's the area right around your nerves. Second, the medicine gets to work, telling those inflammatory chemicals to take a hike. Third, the swelling around the nerve root starts to go down. And fourth, when those nerves calm down, the pain signals they've been screaming to your brain finally quiet down or even stop altogether.
Now here's something that's really important to know. This isn't a one-size-fits-all kind of deal. A good doctor isn't just using the same approach on everyone. The specific technique they use is tailored to your body and your specific source of pain. How and where they do the injection matters just as much as what's in the needle. So there are basically three main ways to do this. The caudal approach is the least precise, but it's also got a really high safety profile, so it's great for more widespread pain. Then you've got the interlaminar technique, which is kind of the middle-of-the-road option for precision. It's really good for pain that's more in the center of your back. And then there's the transforaminal technique. This one is like a sniper rifle. It's highly precise and targets one specific nerve root, which is perfect for that shark shooting pain down one leg. The choice really comes down to your unique situation.
All right, so we know how they work in theory, but the billion-dollar question is, do they actually work in practice? Well, when you look at the short-term results, it's easy to see why these injections are so common. The immediate relief can be, wow, pretty incredible.
Just look at this number for a second. 70%. That means in a major study, 7 out of 10 people got significant relief from their pain in the first few weeks. If you've been living with chronic pain, a number like that is everything. It's hope.
And it's not a fluke. For another condition, spinal stenosis, a study found that almost 90% of patients had their pain cut in half 3 months later. So the takeaway here is pretty clear. In the short term, the evidence is solid. These shots can work, and they can work really, really well.
But you knew there was a but coming, right? What happens after that initial honeymoon period is over? This is where the story gets a lot more complex, and where we have to start asking some tougher questions about the long-term benefits.
Okay, so let's go back to that amazing 70% number we just saw. That's our starting point. That's the initial success. But now, watch what happens. In that exact same group of people, after about 4 months, the number still feeling that relief drops all the way down to 44%. That's a huge drop-off. It shows that for a lot of folks, those powerful initial effects start to wear off over time.
So what does this mean in the real world? It means that one shot is often just the beginning.
To keep that pain under control, a lot of people need to go back for more. In that same study, nearly 60% of the patients needed to repeat injection to keep feeling the benefits. And if you're getting multiple injections, of course, the question of safety becomes even more important. Now, let's be clear. LESIs are considered very safe procedures, but there are some rare risks, like infection or nerve damage. The research shows that using certain kinds of steroids, the non-particulate kind, makes things even safer. But we also have to think about what repeated doses might do to the rest of the body, like potentially increasing the risk for osteoporosis in some people.
Okay, so let's put this all together. You've got strong relief in the short term, but it tends to fade over time. This leads us to a really important shift in thinking about reframing the whole purpose of these injections.
And this is the key concept right here. Experts call it bridge therapy. The injection isn't the destination, it's the bridge that helps you get there. It calms the pain down enough to give you a window of opportunity, a chance to do the other things, like physical therapy, that can give you lasting relief.
And this bridge role is a huge deal from a healthcare standpoint. Why? Because the data shows it's way more cost-effective to use these injections to manage pain and maybe even avoid surgery altogether, especially in the early stages. It's just a smarter, more strategic way to approach the problem.
So, this all leads us to the big picture takeaway. It's about looking at this powerful injection not as a magic bullet, but as one really important tool in a much bigger toolkit for managing pain.
A truly effective plan is what we call multimodal. Yes, it includes the steroid injection to get that inflammation under control, but it's on a team with physical therapy to build strength, changes to your workstation, other medications if needed, and even psychological support to help you cope. The injection is the catalyst that makes all the other stuff possible.
So, we end up back where we started, but with a much clearer picture. For most people, that steroid shot isn't a permanent cure. But calling it just a temporary fix doesn't really do it justice either. It's a bridge. Which leaves us with the final thought. Maybe the future of pain relief isn't about finding one single magical cure, but about getting much, much smarter about how we combine all the powerful tools we already have.